People from all corners of the world, those ones viewing us from Zoom, from YouTube, I greet you in the name of our Lord Jesus Christ. Before you, we are nurses from Bugema University, School of Healthy Sciences, pursuing a certificate in nursing. I am Najamba NORAH with my brother Serinjoji AMOS and my sister Mutuzo NAUME. We are here to talk and discuss about our health. And majorly, we are going to discuss about two healthy conditions, which is hypertension and fistula. By the end of this session, we shall be able to know what hypertension is, the classifications of fistula, causes of fistula, and we shall be able to tell one another what these two conditions are. Before we go any further, we're going to start with Brother Amos to tell us what hypertension is. Go on, please.
Okay. So, I welcome you all to this show. I welcome you all to attend this health session where we are going to learn various things. To begin with is hypertension.
Yeah.
Many people have gotten their relatives having hypertension, and even some of the people have died of high blood pressure. So what is hypertension we are talking about? Hypertension is a condition where the arterial blood pressure has elevated above the normal. It is persistent, and the normal is 120 over the diastolic one. It is 80. But when I say that you have higher blood pressures and you check for them, it means that you have 140 over 90 and above. And under blood pressure, this is where we see that the blood vessel carrying blood, it is getting fatty depositions, that the lumen you had is narrowing. Now when the lumen you had is narrowing, it will lead to an increase in the blood pressure, and this is what we call hypertension.
Okay, thank you, Brother Amos. Now, could you please tell us the classifications of hypertension? Okay, go
Actually, we have three types of classification.
Okay.
We have what we call pre-hypertension. With pre-hypertension, this is the slight deviation in the normal blood pressure, whereby you do something and then the blood pressure increases somehow. You get? And this is majorly ranging from 120 to 139. That is the systolic. And the diastolic is ranging from that is 80 to 89. Then we have first stage hypertension. With first stage hypertension, this is where we see our systolic, when we check for blood pressure, it is 140 increasing to 149, and the diastolic is from 90 to 99. Then when we go to the third stage of hypertension, this is where we are going to see high blood pressure, that the systolic is ranging from 160 and above, and the diastolic is ranging from that is 100 and above. And those are the three classifications of hypertension.
Oh, thank you, Amos. Now, here we go to our sister. Sister NAUME, can you please tell us some of the causes of hypertension?
Okay. Before the causes of hypertension, we can see the types of hypertension, where we have primary hypertension and secondary hypertension.
Okay.
So on the causes, we are going to see those of primary and secondary hypertension. On primary hypertension, this is the hypertension that cannot be cured. Then secondary, it is characterized by, so when you give medication, this condition can easily go. Then on the causes, we have of primary, those of primary and secondary. On primary, we have, remember we said those are the ones that can be cured. We have genetics. This genetics is just inherited from child and mother or father. Then we have age. This is where it goes on increasing as this person is also growing. We have obesity. We have seen these big people, or when you are big, your body is big.
Now, right there, if a person looks at me, he or she might say that I'm big. Now, is this what we call obesity, or you're referring to something else? Clarify more about that.
Okay, you're also big, but what I'm meaning by obesity, there is that extra, extra growing,
extra fatness.
Yes.
Okay, go on.
We see here the fats may accumulate in these vessels, leading to poor supply of blood into the body parts.
That's true.
And we see sodium intake. If we see sodium intake, high sodium intake, we are going to see it in the glomerulus or in the kidneys. And we have stress and worries. As everyone, if you have ever experienced stress, you can see that if you're stressed, even you can hear your heart pumping, you can hear palpitations.
Yeah.
Alcohol consumption and cigarette smoking. Here we see that these two things, they can damage the tissues. Then, as we have finished primary, let's go to secondary hypertension. And we said secondary hypertension, this can be cured. We see oral contraceptives. So if you get like high blood pressure and it's due to these contraceptives, immediately when you leave them, this pressure can lower to its normal. We see preeclampsia, we see it in pregnant mothers. You see here, when the mother is pregnant, this pressure can rise, but immediately after delivery, this blood pressure lowers. That's why you said it is cured. Yeah, we can see endocrine diseases. As we saw in primary high sodium intake, so even these endocrine diseases, we are going to see it in signs and symptoms that is going to affect. So all these can cause hypertension. Thank you.
All right, we've heard her. I'm not adding anything on that. Right now, someone other might be wondering, if I have hypertension, how can I differentiate it from any other disease? Trust me, our healthy personals, AMOS and NAUME, are here to clarify that for you. So please, NAUME and AMOS, tell us the signs and symptoms of hypertension.
Yeah, to continue on that, signs, how can you see that this person is hypertensive? How can you see that this person is having hypertension? We see headache in the morning. On waking up, you feel too much headache. Then we see vomiting. We see bleeding from the nose.
Okay, I'm going to try that, Sister Naomi. As of now, let's have a short break. And when we come back, we shall continue with the signs and symptoms.
Okay, thank you.
All right. Welcome back from that short break. As we were still discussing the signs and symptoms, and our healthy personnel NAUME was still taking us in that. Could you please continue?
Okay. We have been on bleeding from the nose as the sign and symptoms of hypertension. We see chest pain. We see dyspnea. Then we see dizziness, impotence. To explain dyspnea, we see difficulty in breathing. Then they see fainting. We see visual changes. Maybe another one can add on.
Okay, thank you, Sister NAUME. AMOS, could you please pick up from there?
As a supplement to the signs and symptoms, I think also the number one sign and symptom a person can understand is an increase in blood pressure. If at all you go to the health center, you check for your blood pressure and then it's above the normal. And remember we said the normal, it is 140 out, that's the systolic, and the diastolic is 90 and above. That is in mercury. Now, when you check for your blood pressure and you are above that one, it means you're what? Hypertensive, or you have high blood pressure. We have also the chest pain. Remember, if you're having a problem with the transportation of this whatever, the blood in the body, you are going to have chest problems because you can't breathe very well. You get it? So we have fainting. When blood can't reach the peripheral parts of the body, remember this blood carries oxygen. So you are going to be subjected to fainting. You are going to faint, my brother and sister. So we have what we call nocturia. And nocturia, this is whereby you urinate a lot at night. You urinate a lot at night. Also, that is urinating a lot at night. It is one of the signs and symptoms showing us that you have a higher blood pressure. Yes, sister.
All right, thank you. I'm sure someone out there, you're now well conversant with the signs and symptoms of hypertension. And please, immediately you get any pain, you feel anything, you get any sign and symptom of hypertension, please, we advise you to rush to the nearby healthy facility. And so, when we continue with hypertension, someone is wondering, how can he or she manage hypertension? So please, Amos, tell us, how can you manage hypertension?
So, our beloved members, the management of hypertension is very easy at a personal basis. I don't want you hypertension or being hypertensive make you reach the point of death. So I want you, when you do physical exercises, you're decreasing on the blood pressure from the highest levels, which are very dangerous, to the normal levels. Do physical exercises daily. Have a very balanced nutrition, like a very balanced diet, and that's the nutrition status, which is stable. That's good. When you have a nutrition, you can change many things in your body. And then we should tell people to stop smoking. Smoking is also some other bad thing and dangerous thing. Alcoholism. Have a look. When somebody takes alcohol, is introducing a lot of chemicals in their bloodstream, and this is leading us to what we call hypertension. We have reduction in the sodium intake. This table salt we use to cook at home. That salt we are using to cook at home, it is having a lot of sodium elements in it. Now, when you take these sodium elements concurrently, you are exposing a lot of elements in your body, and of which sodium is accountable for increasing blood pressure in the body. If at all you continually take that table salt, or the one we use to cook, without maybe cooking it somehow, it is leading you to hypertension, and it is a deadly disease. Remember, we said hypertension is a very silent killer. It kills you when you don't know. You get? So we have a reduction in taking caffeine. Some of these things we use, brothers and sisters out there, and my colleagues here, they have caffeine. The more we take caffeine in our bodies, it is exposing us to having high blood pressures. And this is gonna kill us when we don't know.
Okay. Thank you, Amos. By the way, if I'm to tell you this, I do physical exercise daily.
Oh, surely.
Yeah, and an hour back, I was just from doing a physical exercise, I tell you. To continue with our hypertension, we want to see, the complications in hypertension. You know, each and every disease has its complication. Now, NORAH, tell us about the complications of hypertension.
Oh, thank you. The complication of hypertension, we see the results of what will come out when you don't treat this condition. We are going to see heart failure. Yet, yes, when we said hypertension, we talked about failure or difficulty in pumping blood, or it is having pressure in pumping blood. So we are going to see heart failure. We see stroke because this blood can't reach to the peripherals and the brain. We see kidney failure, as we saw in the signs and symptoms. That is also a complication. We see impairment of vision due to blood not reaching to other parts of the body. Thank you.
Alright, so you have heard the complications, and trust me, I'm not adding on anything on that. They've said it all. So I would like to have Brother AMOS to, in conclusion, what can you tell the people out there watching us about hypertension in just simple words?
In simple words, I would like to inform the world at large that continually I'd put in efforts to go to nearby health centers to check for your blood pressures. And this is to a point of view that it is not only the elder people or the old people that suffer of hypertension. Even we can have our children, the ones we have just given birth to, given birth to with high blood pressures. From children's, the middle age, or the mid adults, and even the adults, the extra adults, they can all have what we call hypertension.
All right, thank you. NORAH, in conclusion of hypertension, what can you say?
Okay, thank you. In conclusion of hypertension, dear viewers, what you have to do, just encourage exercise. As we have seen that this can reduce hypertension, and continue to monitor the blood pressure to all health facilities. Any health facility that you can go, they can check for your blood pressure. And even these young ones, immediately after birth, you can also check.
All right. Thank you, Sister NAUME. We have had it all. Our online viewers, those ones who are viewing us from Zoom, those ones who are on YouTube. That's the end of hypertension, and I'm sure all your questions about hypertension have been cleared. If at all you have any question, please just send it to, just comment it there, and you ask whatever question you want to ask. Now, we are going to talk about another healthy condition. Remember, we said we are to talk about two conditions. One, which is hypertension, which we have just talked about. And secondly, we are going to now talk about fistula. When a person talks of fistula, what comes into your mind? How do you know any types of fistula? What causes fistula? What are the signs and symptoms of fistula? How can you manage fistula if at all you happen to get it? And how do we prevent fistula? Trust us, at the end of this session, you will be able to know all those. NORAH, please tell us, if someone out there sees fistula, he or she is asking himself, I'm speaking fistula, but I don't understand it. So could you clarify that for us?
Okay, from me, you are going to be cleared all. Fistula, we are going to see it as abnormal communication between two organs. This fistula, as per now, as healthy professionals, we are going to talk about those types of fistulas that you always affect our mothers, that usually affect ladies or the female gender. To continue on that, on the types of fistula, we have those that always affect our mothers. We are going to see there are two, and those are vesicle vaginal fistula and rectal vaginal fistula.
Okay, NORAH, If you talk of rectovaginal fistula, what do you mean by it?
Oh, rectovaginal fistula,
Okay.
just simply abnormal communication between the rectum and the vagina.
An abnormal communication
Yes.
between the rectum and the vagina.
Yeah.
Okay, could you please talk more about that?
This rectovaginal fistula, this communication, what are they meaning? We see, like, between the vagina and the rectum, there may be miscommunication, or that thing that separates these two organs or these two parts, it may be not there, or they may be because of tear. Then this communication, this one will be characterized by involuntary escape of stool, or this content from the abdomen just will be coming out from the vagina.
All right, thank you, Naomi. She has clearly explained what rectovaginal fistula is. Now, Brother Amos, I remember Naomi said that we have two types of fistula, which we are going to talk about today. I would request you to talk about the second one.
So as our sisters, our colleagues have told us that we have very many types of fistulas, but concurrently, we are here to talk about only the gynecological fistulas affecting our mothers, and the second one of it is a vesicle vaginal fistula. Which type of fistula is this one? You may be there wondering. So, this type of fistula, this is the abnormal communication between the urinary bladder and the vagina. And under this type of fistula, we are seeing urine not coming out from the normal parts, but it is getting another route within from the bladder entering the vagina. So this is whereby you'll find our mothers, they are having urine incontinence. With urine incontinence, I mean they are concurrently every time they're passing out urine. And this is what I mean by a fistula, that there is a journey created where it was not supposed to be. That is a fistula. That's a vesicovaginal fistula.
All right, thank you, Amos. I'm very sure he has cleared all our questions about the vesicovaginal fistula. Now, we want to know the causes of fistula. What really causes fistula? Amos, could you please help us with that? What causes fistula?
There are many things that can cause fistulas.
Okay.
And since I told you that we are tackling our mothers of the world, mothers of the nations, and mothers of everywhere, we are tackling this. So there are many cases causing the abnormal communication or the abnormal pathways within two organs of the body, whereby you find the vagina communicating with the bladder for urine. This shouldn't be like this. So what are the causes? The first number one cause, we have traumas.
Trauma. If you say trauma, what do you mean?
Trauma, I mean the injuries. They can be mechanical. Maybe the mother was doing her works here and there, and then she fall onto sharp objects. But these sharp objects, they injure the gap between the bladder and the vagina. So you find that urine is running direct into the vagina.
Okay.
That is mechanical injury. And then we have what we call the cesarean sections we go for. You can go for a cesarean section because the doctor was trying to panic, you don't lose out blood, and accidentally they suture, or the needle goes wrongly, and then it marks a disconnection. Like, for example, I can give you in this fistula, whereby the bladder, the rectum, and the vagina are connected. They might be suturing our mother when she's in cesarean section, and then they connect a gap there which shouldn't be there. We have infections like chronic tuberculosis. You know, chronic tuberculosis has a lot of microorganisms that spread all over the body, and when they spread all over the body, they are going to affect the vagina. And when they infect the vagina, they are very dangerous. They are going to cause miscommunication, and hence creating a gap there, where we shall find urine again entering the vagina. We have prolonged labor. When I talk about prolonged labor, what do we understand? Or difficult labor? With prolonged labor, this is when it is very difficult for the mother to conceive or to deliver under normal circumstances. Why is it like this? What cases are bring about normal labor? This is when the head of the baby is very big to pass through the birth canal of our mother. Now, because it's like that, the mother is going to try her level best to deliver, but as she's pushing under contractions, this head is pressing over the tissues of the pelvis area. So the tissues are going to lack blood. When they lack blood, they are going to die. And when tissues die, they can easily be damaged and to cause a miscommunication. That is prolonged labor. We cannot talk about episiotomy. This is when still the baby can't pass there, but then we decide to create a way to increase on the birth canal. When we increase on the birth canal, our baby can pass. So in that way, when we are trying to do the episiotomy, also we can cut areas we are not supposed to touch. We have another point called the hysterectomy.
Hysterectomy, when you talk of hysterectomy, what do you mean?
With a hysterectomy, I mean this is a surgical procedure of removing the uterus.
Oh.
Maybe we have gotten different cancers there, as you know, cervical cancer. So we need to carry out this procedure to remain with our mother still on earth. So we are going to carry out a procedure called hysterectomy. This is the removal of the uterus. But as we are removing it, we might there might be a cause of miscommunication and passages which are created and they shouldn't be there, and that is what I call a fistula. We have inflammatory bowel diseases. Now, for example, I can give you inflammatory bowel diseases. We have what you call hemorrhoids.
Hemorrhoids.
Yeah.
Okay.
With hemorrhoids, this is where we see a dilation in the blood vessels of the rectum. Now, imagine if our mother has a dilation in the blood veins of the rectum, it is going to bring about a miscommunication between the rectum and the vagina. And so we shall find the gas, stool, which should have gotten out of the rectum, and it is getting out of the vagina. And that's where we see that our mothers facing this problem, they have a foul smell. It is actually smelling so poor. Because imagine what should have come out of the anus is coming out of the vagina. That is
a dangerous situation.
Inflammatory bowel diseases.
Okay, thank you, Brother Amos. I'm very sure we are now well conversant with the signs and symptoms. He has mentioned it all. And if at all you're having any of that, please, my dear mothers, my dear fellow women, please run to the nearby healthy facility to seek for healthy attention. And now, if a person has this fistula, how can she manage it? Or if a person has a relative who has fistula, how is she going to help that person manage that fistula? NAUME, help us in that.
Oh, thank you. How can we manage this condition? As we have seen that we have infections, can just manage this condition, or maybe it can be caused by infections. So we can give antibiotics, and in these antibiotics where we have ceftriaxone and metronidazole, those are antibiotics that can cure these infections. We have hygiene. We have to maintain hygiene, as we have seen that foul smelling, there is foul smell in this. So as mothers facing this condition, we have to be hygienically good. We have to be bathing regularly or frequently.
Surely.
Yeah. We have to reassure these mothers with this condition, as they suffer psychologically. They feel withdrawn, depressed. So as we have to reassure. And if you are there, you're a man, and maybe the wife is having that condition, we should not reject them. They are also human beings.
Okay, a moment, NAUME. Before you continue with the with management. We want to first look at the signs and symptoms. We had missed a very crucial step. We want to see the signs and symptoms of fistula. How can somebody out there know that she is having fistula? Amos, take us through that.
For the signs and symptoms of fistula, number one symptom I can say, we have what we call dyspareunia. This having pain during intercourse. You might have a pattern there, and then when we are going into a sexual intercourse, there is a lot of pain, undesired pain. And this undesired pain, it can be one of a sign signifying that our mother there, she's having a fistula somewhere.
Okay, so we should take note of that. Dear viewers, if at all you're having sexual intercourse and you find out that you're having any abnormal pain, please just consult the healthy personnel. Go on.
Another thing I'm going to talk about, rectal bleeding.
Okay.
Rectal bleeding or vaginal bleeding. You can be there in day-to-day life, and then you have vaginal bleeding. They might not be menstrual periods, but you just out of the blue you find yourself having vaginal bleeding or rectal bleeding. This having blood from the behind, from the anus, and that can also signify that we have some fistula somewhere. Then I would like to talk about the gas or pus or stool. Remember when we talked about rectal vaginal fistula, we saw that the stool, they are coming out from the vagina. So when you see such things coming out of the vagina, you should know that there is a fistula.
Okay.
We have another point of having a little urine passed out, because you have to urinate.
So I thought that passing out little urine is a normal thing. You mean it's just a sign of fistula?
Remember, it can be a sign of fistula. Why? Because the bladder is affected. You get it?
I get you now.
Now, if the bladder is affected, urine can't come out frequently, because as a person, you are feeling pain. You are feeling pain to let out urine go. Now, since you are having that pain, you won't easily let out urine. So little urine will be out, and also we shall find excessive linkage or output of urine from the vagina, and that is not the passage of urine. That's another thing. We have abdominal pain. You find mothers having abdominal pains every time. Please run to the nearby healthy facility. You seek for medication, seek for medical advices from professional doctors, and this will help you out.
Okay. Thank you, Brother Amos. Now, may you have anything to say about the signs and symptoms of fistula?
Oh, thank you. To add on the signs and symptoms, we saw as there is abnormal communication, we see instead of stool coming from the rectum, it's coming from the vagina. We see vaginal bleeding. So we are going to see foul smell.
Yeah.
This mother is going to be smelling. So we have to prevent it, and the prevention we are going to see as we go on.
All right, thank you. Someone out there might be wondering why we're talking about ladies, mothers, women, or that we're talking about them in this situation.
Yeah.
And mind you, fistula affects mostly the ladies.
Surely.
It affects mostly of the ladies, and that's why in this session we are mostly talking about the ladies. NAUME, you are still continuing with the management of fistula.
Okay, thank you. As I was continuing with management of fistula, we saw proper hygiene.
Yeah.
These mothers have to be hygienically good due to this condition and foul smelling, to prevent that foul smelling. As we said, infections, we prevent these infections by seeking for medical attention. Then we get antibiotics, because these antibiotics, they are the ones that cure or prevent or treat infections.
True.
We see, as we saw, enough exercise is also good to boost our immunity in order to prevent these infections from invading into the bodies. We have to educate these mothers and their husbands, or we have to educate the world on how to have sex. As we say, on the causes of fistula, we saw even sexual abuse can cause this condition. So we have to teach people on how to have sex.
Safe sex.
Yeah.
Thank you. Thank you, NAUME, for that. Dear ladies, you've heard it all. I'm not adding anything on that. At this juncture, we're coming to the climax of our session today. But before we conclude, I'd like to have Brother AMOS to give us some concluding remarks.
Of course, through everything we have gone through, I think we are not leaving you the same, people. We are not leaving you the same. You have learned something from here. Do daily checkups. Your health matters a lot. Your health matters a lot. Run to the nearby health facilities. You do daily checkups. So how is my blood pressure? How is my gynecological condition? Go to antenatal cares. Mothers, never despise the fact you have to go for antenatal checkups. Through antenatal checkups, this is where we realize, are you yet to have abnormalities like fistulas when you are delivering? Will you have prolonged labor, which will lead you to fistula? Will you have preeclampsia, which is another cause of hypertension? So I'm emphasizing the entire world. I'm emphasizing a particular person, whichever country you are in. I'm emphasizing you do daily checkups and do them with the trained healthy personnel. Something I want to leave the world with: ounces of prevention are worth pounds of cure.
Thank you.
I rest my case.
I believe they've heard all that. NAUME, in the same way, also give us some concluding remarks.
Okay. In conclusion, what can I say on that? Encouraging our mothers to always go for antenatal care when they are pregnant, because during antenatal care we learn a lot of things. We learn the complications and the problems that can come from smoking when you are pregnant. Yeah, we can prevent mortality and morbidity of these children or babies. Even in conclusion on this fistula, what I can say, usually or always go for screening, and when screening, go for these professionals or profession doctors like gynecologists. Like for example, these mothers, you have to go for gynecologists because they are the ones who knows your conditions very well, because they specialize in only your conditions. What I advise you, always go for gynecologists to screen and examination.
Okay, thank you. In the same way, I call upon our dear men, please do not neglect your wives because of that fistula. Instead, help and encourage them by reaching out to the healthy facility. Don't just neglect them. You say that because she's having a false meal, you be like, I won't go near her. Please, no. Just advise her, talk to her, advise her to go to the nearby healthy facility.
By the way,
yes,
these husbands, they are kindly stubborn.
You're right.
When they get their wives having that false smell, they can tend to run away.
But it's not good at all.
It isn't like that. You have to believe the condition. Be their strength in your woman, because you are improving them psychologically. Because we see love is one of the professional thing we advise people. Love your fellows and increase their level at which they will heal. So when you run away from your wife because of that smell, you are torturing her psychologically, and this will delay her healing from the fistulas.
Oh, to add on that, these men, they tend to leave their wives because of these conditions, and they even marry others.
Serious?
So what I'm encouraging men is that even the Bible doesn't like that, because even in church during divorce they say in pain and what? Happiness and sorrow, sickness and health. So you have to be with this wife. These conditions can heal. So it can't take long. So don't get other wives because your wives are having such conditions. That's what I'm encouraging.
No condition lasts forever, by the way.
Yeah,
true. I'm very sure men have had that. And I'm confident that we have cleared most of your questions you're having about hypertension and fistula. If you have any question, please just ask. We are there to answer you, to respond to each and every question of yours. I thank our healthy personnel, AMOS and NAUME. You have really sacrificed your time, and trust me, it's been worth it. Many people out there, they have come to know more about hypertension and fistula, and trust me, you have really done a very good job. Sincere appreciation to the organizing committee of this program, to the Global Family Net Conference team, the organizing pastor, Dr. Pastor Daudi Ndekeja. Thank you so much for the opportunity you've given to us, and for giving us this platform to share to the world these two healthy conditions. We really appreciate you. May the good Lord bless you. Still, we appreciate the people behind the cameras. Brother Enos, may God bless you. Call upon someone watching this video. Please like it, share, and so that it can reach to a person who needs to be saved. Thank you so much. Bugema University, excellence in service. To love and serve is our motto as nurses, for God and my country. But before we close, let's have a word of prayer from our dear sister NAUME.
Okay, let's pray.
Okay.
Our God and kind and loving Father in heaven, we thank you for the gift of life you have given us. We thank you for the protection you have given us. We thank you for this beautiful moment you have given us to talk to the world. Be with us, be with them who are watching us. Give them confidence, give them guidance. Let what they have seen and what they have heard stick on their minds, and they put them in action. I pray, being and trusting in the mighty name of Jesus Christ.
Amen. I really appreciate you. May the good Lord bless you. Still, we appreciate the people behind the cameras. Brother Enos, may God bless you. Call upon someone watching this video. Please like it, share, and so that it can reach to a person who needs to be saved. Thank you so much. Bugema University, excellence in service. To love and serve is our motto as nurses, for God and my country. But before we close, let's have a word of prayer from our dear sister NAUME.